This portion of Carlos and Lisa is brought to you by Scan Health Plan.
Well, we're here talking to our friends David and Holly from Scan Health Plan. Scan, as you know, is a local not-for-profit Medicare Advantage prescription drug plan for people over 65. They've been headquartered in Long Beach for 44 years and have more than 220,000 members in California, which makes them the second largest not-for-profit Medicare Advantage plan in the state and the third largest in the nation. They join us regularly to educate people eligible for Medicare about the best ways to get the health insurance and prescription drug coverage they deserve. Welcome back, David and Holly. All right, start us out today, Holly. What will Medicarians learn today?
In keeping with SCAN's mission of keeping seniors healthy and independent, our aim on all the segments we do with you is to help educate people eligible for Medicare on how to make sure they are making the best decision about how to access their health care through Medicare. And we've brought another SCAN executive along with us today to provide additional education on a topic that is of interest to seniors.
Carlos, I'd like to introduce Jill Selby, who is our Senior Vice President at SCAN. She shares Holly's and my passion about seniors, and I know you and your viewers are going to find her incredibly knowledgeable about Medicare Advantage plans, and most specifically, how plans like SCAN determine how to structure the plan benefits to best meet the needs of the members that they serve.
Welcome, Jill. We're delighted to meet another member of SCAN's leadership team.
I'm so glad to finally meet you, Carlos. You know, feedback from folks who have seen SCAN segments on your show have been really positive.
Well, I'm delighted to hear that. Let's jump right in with my first question for you. I understand that seniors on Medicare had to choose their health plan for 2021 by last December 7th. There's so many plans and each plan's benefits are different. So how does someone choose, and can you talk more about that?
Yeah, and good for you for knowing the December 7th date, but I'll add one more thing, is that there's still time to make a switch or a change. The federal government, and you might have heard this on a previous segment with Holly and David, the federal government introduced another period called the open enrollment period where you can switch. So knowing that we're in that time right now during this segment, you have till the end of March to switch, and we'll probably talk about that again later. But one thing I want to emphasize, and I'm sure you said, I've heard this on every SCAN segment, but we believe in it wholeheartedly, is that use a local licensed insurance agent. If you know one or have heard of one to help you sort through things, I can tell you even when I turn 65, I plan on using an insurance agent. So one thing to know about all plans is that we kind of refer to benefits as table stakes, meaning that most of the plans offer very similar benefits. Things like gym and vision and hearing. So you're going to see those across all health plans. But I always advise people who ask me is prioritize the benefits that are important to you, because it's very easy to get distracted by what we call shiny objects. So you want to make sure that those things that are important to you are also part of the plan you're looking at. But first and foremost, do they have your doctor? It's very important that the plan you are going to choose has the doctors and hospitals that you're interested in, that you participate with. So that's number one. The other thing is drug copays. I always tell people who are shopping on Medicare, the majority of benefits people are going to commonly use are prescription drugs. So look at those drug copays, and even for those of you who have diabetes, you want to look at that insulin copay. Now, I'm not going to brag or give too much away, but I can say that SCAN has really strong insulin coverage. The other thing you want to think about are things like transportation and dental and other things like that. So if there's a plan out there that, for example, has you attracted to a benefit, let's say like chiropractic, you've never used it, but it sounds exciting, and maybe they don't have transportation, but you don't own a car. You really need to make sure that the plans that you're looking at are going to offer you the benefits that are important to you.
Well, thanks for that information. When you're designing benefit plans for SCAN, What are you thinking about?
Well, I tell this to everybody. I think about my parents who are SCAN members, and I know they'll hold me accountable, as will my friends and family that I've also referred to SCAN. And so for those reasons, and for the reasons of all of our 220,000 members, I really focus on being consistent and sustainable. And that means I'm not going to throw a benefit out there one year and take it away the next. And I got to be honest, that's pretty common in this industry. So be on the lookout for that. The other thing is we want to be sure that the plan meets the senior's current and future healthcare needs. And a little bit of bragging on my part, our 40-year history of understanding seniors' healthcare and the continuum as they age and their healthcare needs change, we design benefits with that in mind. And then also important is, will the majority of seniors use the benefits? I think of things like vision. Every senior is going to use that, but using my acupuncture example, maybe not all seniors are going to use that. And also, are the benefits understandable? If our members don't understand the benefits they have or how to use them, they're really not worth anything. And last but not least, no gimmicks. And when I say gimmicks is, if it sounds too good to be true, it probably is. So we have a no gimmicks rule at SCAN.
What is one last thing you would advise a senior who's shopping for a Medicare Advantage plan?
Yeah, look beyond benefits. There's a lot of plans out there. I know David and Holly have spoken about the hundreds of plans are available, but you want to kind of lift the hood and look beyond those shiny benefits. What's the history of the health plan in dealing with the senior population, and where's their focus? A lot of the larger plans out there serve wide populations, and so they kind of have to share their attention. Whereas plans like SCAN, we focus 100% on seniors. High quality plan. Hopefully you've heard about those star ratings. Those are ratings that are issued by Medicare. We refer to them as CMS. SCAN has a 4.5 star rating for over 4 years. And a lot of other plans have good ratings too. So be sure to think about the quality ratings of a health plan as well. And then talk to friends and family. I know many of us have people who are on Medicare Advantage plans and they've had good experience and not good experience. So you'll want to talk to friends and family and see what plans they trust. And if you make a plan decision, remember I said earlier, you can always change either in that AEP, which is the annual election period from October 15th through December 7th, or now in that OEP, the open enrollment period that ends on March 31st.
Well, thank you, Jill. David, Holly, you were certainly right. Jill would provide a wealth of knowledge. I get smarter with each SCAN segment that we do. I can't wait until the next time that we can virtually be together.
Thank you, Carlos.
Thank you, Carlos. You're the man.